Hello, everybody. This is Taz Street with Positive Out Loud. Today, I have a very important guest on the show. I have Rena Patel. She is a doctor, infectious disease and HIV researcher, physician at the University of Washington in Seattle. She's also assistant professor in the Division of Allergy and Infectious Diseases in the Department of Medicine at the University of Washington. She completed her medical school at Stanford University and her Master's of Public Health from the Harvard School of Public Health and a Master's of Philosophy from the University of Cambridge. So she has worked all over the world. She has worked in India, Tanzania, Ghana, Zimbabwe, Uganda, and I'm very honored to have you on the show today. Thank you.
Thank you for having me, Taz.
Yeah. So tell me a little bit about what's going on now at University of Washington, what you're doing now.
Yeah, things have changed dramatically in the last 2 to 3 weeks. As people are aware, the COVID-19 pandemic has really hit home here in Seattle and in nearby counties in Washington state. And so University of Washington has really found itself in some ways at the initial epicenter of the US epidemic of COVID-19. At the moment, arguably, we are no longer at the epicenter, which is perfectly fine with me.
Right.
New York City and New York State has more number of absolute cases, but there's no doubt that our region has really been significantly affected by COVID-19.
And so I want everybody online to know that the reason I know you is because your daughter goes to school with my daughter at the elementary school. So that's how we know each other. And we happened to run into each other at Target and I was asking you a ton of questions and I'm like, hey, would you mind getting on my podcast? So that's why we're here. So
yeah, I'm absolutely delighted and happy to provide any insight that I may have. There is a lot of information out right now about COVID-19 and a lot of good information, in my opinion. So I feel like everyone might be on information overload, but I am more than happy to help sort of filter that and think about some key ideas to stick with when dealing with this in our communities.
So what the best ways to stay healthy through all this that everybody should know about?
Yeah, one of the first things, which Taz, you're part of, is thinking positively. It is interesting time. People are, routinely using words like challenging, stressful, uncharted territory times. And it's true. And I think it's important at any time like this to remain positive. And it's not easy because I think, people have a lot of thoughts and questions. Just this morning, I was out gardening in our front yard and our neighbor had a lot of, came down and asked a lot of important questions like, should I be wiping down the groceries that other people are bringing me? Should I let my friends and others in my community, they're an elderly couple, so they're not leaving the house much at all. But a lot of other people are bringing things to them. And so she's like, should I let people bring cooked meals to me anymore? It's a lot of important questions that, there isn't the best information or data out there to guide us on what to do. But I think it's important to stay positive. So I would say staying positive, there are probably two aspects to it. One is the mental health and the other is physical health, and to try to do your best to remain as healthy as possible physically. And I think there are some things people can do right now. I will say, for example, there are some things that you can't. As an example, my main physical exercise has been trying to swim 1 or 2 times a week. And now with our local public pool closed, that's no longer my go-to for exercise. So that's really impacted my physical health. And I'm sort of rethinking how else to exercise. But we know some ways are definitely safe. So anything you can do to exercise in your house, within your own house or household, is perfectly fine. And then there are other things you can do outside as well. So definitely, if you can do things that maintain at least 6 feet of distance between you and others that have minimal contact. And I would add on a layer of minimal contact with other things. So not just people, but also things. And so that's
Right.
why the parks in our community have, the Parks and Recreations Department have closed down playgrounds and, basketball hoops and tennis courts, because we know the virus can be found on and survive on objects. It's important to try to maintain your distance away from those things as well. But people have been talking about running, going for walks with their family, bicycling. A lot of these sort of non-group individual activities are always a good thing. And I would encourage people to try to do as many of those as possible.
Well, luckily for me, I've been working out at home anyway with a little app that I've been using. So, and then yesterday we were doing the gardening and just like digging dirt, and I was getting lots of exercise. So it's like, if we weren't like made to be stuck in our house, I probably wouldn't have did that.
Yeah.
I mean, I've been exercising and stuff, but I'm just trying out different things. It's like got to be a little bit more flexible, right?
Yeah. I think you hit on a good point about flexibility and being able to adapt to the changes. We don't at the moment have a shelter in place or lockdown policy in Seattle area, but
Yeah.
that may happen any day. So you're right, kind of thinking about how to be flexible and adaptable. I've been joking with people how probably all of our gardens are going to be really abundant this season.
You
Because
should see all that compost out there. Yeah.
right, exactly. Yeah, we're all home for so much time, so might as well, spend time outdoors. And I want to make it clear that it's, um, what we know about the virus that causes COVID-19 is that it's a large size viral particle, and so when people cough and sneeze, that it's very likely to actually not hang around so much in the air, unlike other pathogens that, for example, that cause TB, which are small enough and can actually be in the air for a long time. This one is large enough where the particle tends to drop down and fall onto surfaces, tables, floors, etc. And then probably the other way is when you're really close to someone who coughs or sneezes, then it's possible that you might inhale the viral particles right away. But the good part is that it's not out in the air for so long, and ultraviolet light, UV light, which is abundant from the sun, we know likely denatures the virus. And so being out and about in the sun, in ambient temperature, weather, where there's good circulation, etc., I would say is good things. But just to try to avoid playgrounds or other surfaces that are high touch area. That's sort of the only recommendation I have, is to try to avoid those kind of playground surfaces. Other than that, probably most things outside are okay to be in and around and engage with.
Probably not a good idea to go barefoot right now.
Actually, feet might be okay, because the main transmission modality, I'm thinking a little bit of,
here, right? Yeah.
yeah, a little bit more precisely, as you've probably already seen, I've touched my face multiple times that we've been talking. That's thought to be, other than inhaling the particles, viral particles, the main modality of transmission is thought to be from getting the virus on your hands and then touching your face or eyes, nose, mouth, surfaces where the virus enters our body. And so that's why everyone has been stressing hand washing the most. And it really so so jokingly I say maybe feet doesn't matter. Of course you don't want to get your feet in places that has a virus, but as long as you aren't a newborn that's sucking on toes as
Oh
well,
God, yeah, I was gonna say
feet
you don't
should be
want
okay.
baby crawling on the ground.
Yeah, but the main thing is hands.
Okay. Um, so I know that they were trying to get these tests out. Do you know anything about how the testing is working in the state of Washington, or how that's going?
Yeah, I'm peripheral to the effort, so I don't have so much insiders
Hmm.
info. But initially, the CDC had wanted everyone to be tested with their test kits. Up until recently, all the test kits we've used in the US have been based on PCR technology, which takes portions of the viral RNA or genes and amplifies them to detect them. And so it's a fairly high level technology that's not easily available in all settings around the world. But here in the US, it's a common enough technology that we use it quite a bit.
Hmm.
And so that was the CDC's preference. And they gave these prefabricated kits out to the state public health laboratories. And so we were, when we had the initial few cases, we were sending those tests down to the state lab to get a result back. And as you can imagine, there's a time of literally transporting the sample, running
Hmm.
it, getting the result back. And then the FDA and the CDC acted a little more quickly and gave permission for local labs to start doing
Hmm.
this. And so the University of Washington Virology Lab, which has a lot of expertise in PCR techniques for all kinds of pathogens, including viruses, started using an in-house assay and got approval to run the clinical samples there. And then those that would test positive would get sent to the state lab to be run there to confirmed. So that's why you were hearing terms like, well, suspected case can mean a few things, but you would hear things like a likely case that then had to be confirmed by the state testing. I think the future is moving in a few different directions. One, the PCR testing is so highly specific, meaning that if you test positive, it's highly unlikely that the test is falsely identifying you as being positive.
Oh,
In
good,
other
good.
words,
Hmm.
yeah, this is a general characteristic of PCR methods in general, that they're highly specific. So I suspect over time, we'll probably move away from this requirement to have the confirmatory testing done by the state lab. The second direction we're moving in for testing in terms of the technology itself is, I believe just Saturday, the FDA approved the first antibody-based testing. And so the way these types of tests generally work is your body gets exposed to a pathogen, to antigens that are specific signals on the outside of the virus, and our immune system then develops antibodies in the whole cascade of fighting the
Hmm.
pathogen. And so the good thing about these types of tests is you can use them what we call point of care, near the person. So they may be done if people are familiar with strep throat testing.
Hmm.
Generally, there's a rapid strep throat test done in the clinic by the providers in like 30 minutes or so, and you get the results back. And then there are other techniques that are done lab-based. So I think we're moving rapidly in that direction of using this antibody-based testing, which hopefully can be done right then and there, and people can have to wait for this first one. The company says 45 minutes, but it's probably more like 60 to 90 minutes when you take everything into account, but relatively quickly. And so a person can wait and figure out the answer right away, and also in the outpatient setting. And then in the inpatient hospital setting, it'll be really helpful too, because right now our turnaround time is still about 2 days. It
Okay.
used to be 3 days or more. So the more time we can cut down, the more helpful it is in terms of resource allocation. Because if the person is not positive, then we can quickly get them out of all this high resource environment we have them in right now, the special types of beds, special types of staff that take care of them, and move them to a different part of the hospital. In terms of the, and then I would say the third way that testing is changing rapidly is testing with systems or modalities. So I think we're going to see much more of the type of drive-in testing that UW has been offering at its Northwest campus for UW employees and staff. And I think as of the end of last week, I believe they opened it up to all UW patients, and I'm hoping they can scale up quickly to be able to offer it to all people who want to come by and get tested. It's very limited capacity right now, but if not at UW, people have talked about Google Maps trying to facilitate people who are looking for testing to go and get tested and so forth. So I think we'll see, creative ideas coming forth on how to get tested. It's interesting. I think there's if we were living in an ideal world where we didn't have limitation on resources, I think what we would have done is what people have done in some parts of Italy, South Korea, and China, which is take all the testing door to door. You blanket an entire neighborhood, test everyone you know, and find out who's positive, isolate them, take every effort you can to figure out who they were got in touch with, warn them, get them isolated, and cut the chain of transmission for COVID. So I'm so disappointed that we don't have that type of capacity right now in the US. Had we had that, it's been shown, in towns, small towns and cities in Italy, where they implemented that type of effort, that they were able to contain the virus and haven't had, in addition to other measures, haven't had any new infections. So I think we'll be moving in creative directions in the future for testing for COVID-19.
So do you think it's better that Seattle does get locked down then at this point?
It's a really tough decision for any leader and politician to make, because it has so many downstream consequences. Every time I think about it, I feel like I get goosebumps thinking about the social and economic impact that's going to come out of this. But I will say, from a very, small experience I had in early March, where I was poised to go travel to Boston for one of our leading HIV conferences called CROI. And what they decided was initially that they would hold a hybrid conference. Some people could come in person, and some people could come, join virtually through live webcast of the sessions. And, as a relatively junior faculty member who's working really hard to, do the research and promote it, I had the opportunity to give an oral presentation, and then they invited me to a press conference afterwards. And, otherwise this would be like one of the highlights of my career so far, to be able to present the study that our group has been working on, and then, to disseminate it more widely. So I was so conflicted. Yes, I could join via a virtual aspect, but going in person would give me all these additional opportunities. But then finally, the morning before I was about to travel, the conference organizers decided to just make it a virtual only conference, not have anyone come together. And obviously 3 weeks later, it's clear that was the right thing to do. But in that moment, there was so much agony in my family about what was the right thing to do. I was in some ways, from a self-centered or selfish point of view, wanting to promote the work. Of course, it has policy implications for women living with HIV across the world. And I want, this knowledge to move forward so that the women can benefit. But even then, it felt a very self-centered kind of thing when my husband was like, what if there's a lockdown in the week that you're gone and you can't come back? What if schools get canceled? Which did. eventually in that time
Yeah.
that I would have been away. The schools got canceled. It would have been so difficult for him to cope with things. And what I
Mhm.
learned from that, being in the position, those like 32 48 hours that we were trying to decide if I should travel or not, was that it's really agonizing for individuals to make these decisions. And that is the moment where leadership needs to step in and be decisive and say, this is what we need. It potentially could be an overreaction, and it certainly will have these downstream consequences, but that's the type of leadership we need right now. And so, as a long-winded answer to your question, yes, I think we should likely be on a lockdown, and I think Governor Inslee should move in that direction. And the reason I
Yeah.
see this is because of, Friday I was on that Q&A session for our school's PTA, and people were asking me that kind of question, like, oh, okay, I've been going to the playground in Seward Park with my children, and there were only one or two other families at that time. Is that okay? And my reaction was, probably, big picture, it's probably okay. But we have growing evidence suggesting that children are asymptomatic carriers. So we know that children for sure are less likely to develop severe infection from
Mhm.
COVID-19. But there's increasing evidence to suggest that they may have the virus and are capable of transmitting it to others, even though they have no symptoms whatsoever.
Mhm.
And so you know, with playgrounds that are such, and having small children, we know, how much they wipe their nose and then, go, go, go on the swing or go down the slide nonetheless. And, it's just, playgrounds are probably not the best places to be right now until we have a better handle of where we are in the trajectory with the epidemic.
Mhm. Right, right. So say you do get it and you isolate yourself. So and then you go through the symptoms. Speaking of symptoms, what I know we were talking about this before, but does everybody get a fever? I mean, how does that work?
Yeah, great question. So the most common symptoms that are reported are cough, whether it's dry or productive, fever, and some shortness or difficulty breathing. However, in the largest study published to date, which is from over 1,000 individuals in Wuhan, China, what we've seen is less than 50% of the people present with, for example, fever at the time of seeking hospitalization. So these are already people who are feeling ill enough to go into the hospital, and only 40% or so had a fever at that point. More go on to develop, nearly 70% or so go on to develop a fever during the hospitalization. But very few had all three symptoms. So
Okay.
that is part of the unfortunate thing about COVID-19 is the symptoms are so non-specific. At least with the influenza, we kind of have the sense, like, if you have a high fever, body aches, and just feel totally run over, like you were hit by a truck, you feel very different usually than you do with any common cold.
Hmm.
The symptoms are a little more clear with influenza. With COVID-19, they're not, unfortunately. You know, being a parent with two small kids, a 2 and a 5-year-old, like almost every week of my winter, I have those symptoms, as do my children who are passing it on to me. So the symptoms are very non-specific. And so my advice to people right now is any symptom you have, runny nose. There was a publication yesterday from a group of ENT physicians from China that's saying loss of smell is often the very first symptom. That's really hard to keep track of, I would say.
Yeah.
um, yeah, so but just like any sort of symptom you're having from like your nose down to your lungs, um, just go ahead and self-isolate
Okay.
until we have more robust testing. They're really, if you're feeling fine, which means basically you're not having any trouble breathing, then you don't need to seek health care. You don't need to go to your doctor to get tested. You don't need to go to the hospital to get tested right now, and just stay put, self-isolate yourself, which generally we're recommending 14 days or 72 hours of being free of symptoms, whichever comes longer. And it's really
Mhm.
hard to implement that. I know staying inside a house for 14 days is not easy, but of course, you can go to your front yard, backyard. It's
Mhm.
not, we just don't want you interacting with other people and potentially transmitting to them. So those are
Right.
the symptoms to watch out for. I will say there are certain individuals who have come, who've presented with rare symptoms, which also include the GI tract. So their first symptoms are an upset stomach, nausea, vomiting, or diarrhea. And we know that the virus is definitely detected in feces and stool. We don't know if that's a way someone can transmit it, but clearly the virus is affecting the GI tract as well. So any of those
Mhm.
symptoms, you should stay put. And if you're feeling quite ill, then seek care.
Mhm. Okay. And then once you get it, do you have the potential of getting it again? Or are you immune to it? And how does that work? That's what everybody's
That's,
asking.
yeah, that's a fantastic question, reinfection. And unfortunately, we have no data at the moment
Mhm.
to really guide us in whether people are susceptible to reinfections. Generally, um, our human immunity acts in a way that if you get an infection, at least for the short time, there's enough memory in our immune system to protect us from getting that infection again. Definitely in the short term, sometimes longer term too. But as we see with chickenpox, people tend to used to get it as children, or get vaccines as children, and then as they get older, it tends to come back as shingles.
Mhm.
So it's hard to know where things will go with COVID-19. We know that um, other coronaviruses that cause common colds, interestingly enough, it's a phenomena that we don't have an answer to yet, where genetically, when you look at the viruses from one season to the next, genetically they're very similar, but somehow our body tends not to remember the infection from one year to the next year. And so that's why we tend to be susceptible to common cold from coronaviruses every season, every
Right.
winter season, so to speak. And so, so it's hard to know exactly yet whether people will be susceptible to reinfection. Certainly at the moment, there's no role for herd immunity, this idea that if enough people in a community are either exposed to or in some cases vaccinated against, that they have immunity against the infection, that they can protect others. At this point, it's too early to comment intelligently on whether there'll be herd immunity. Um, but certainly we simply, just don't know if reinfection will be possible. My
Mhm.
hope is not from what we're seeing in China, at least in the short term. Reinfection may not be possible.
Yeah, because they're starting to go back to work. Yeah, that's from what I've
Right.
seen. It looks really positive, right? But they were how long were they on lockdown? Do you know?
I don't know precisely because different cities and provinces have done different
Right.
approaches. My understanding is that Hubei, which is where Wuhan is located, is still mostly on a lockdown. So I'm not sure how
Hmm.
long. But if you can generalize, January 1st was the first day that the authorities took any actions towards a lockdown, which was first closing down the market, um, where the initial reports were coming from. And, over the next 2 weeks, a lot of dramatic actions were taken. So if early January is when they started taking some measures, and early March is when we started to see, some definitive evidence that the curve was coming down, epidemic curve was coming down, it looks like probably in 2 months or so, China was able to, flatten the curve, so to speak, and improve it, get to the other side of it. In the US, Taz, I was talking to my sister this morning about it.
Yeah.
I'm afraid we're not gonna, even with the efforts we're doing, I think unfortunately What's different is China, even then, if you look at some of the heat maps of like the number of cases in different parts of China, it's really the Hubei province that was most affected, and the rest are not as affected. You know, there are definitely cases here everywhere. But in the US, I think we reacted a little too late. And still are probably not taking as intense measures as places like China did. So I think our epidemic curve is, we're not going to see the other side of the curve probably for longer than 2 months. So I'm afraid it's going to be closer to maybe 3 or 4, but still hopeful that it's not more than that.
Right. Yeah, that's the next question I was going to ask you. How long do you think this quarantine is going to last? So, yeah, I mean, because I know in China they were a lot more strict about what they couldn't do, and they were able to stop the spread a lot easier that way. Not that, I
Yeah,
mean, it was still horrific, but yeah.
yeah. It's also right. It's hard. Exactly. My sort of guess, and I'm not a modeler, so I don't, know have any firsthand information, but from what I'm seeing, I suspect it's going to take us on the order of 3 or 4 months to get to the other side of the curve. But and I think this is what I believe it was Governor Inslee who said it on Thursday or Friday. If you're going about business as usual, then you're not doing your part. We really need everyone to do their best to do social distancing if this is going to work. It as we've seen, it takes one individual who initially traveled to Wuhan and came back to Washington State. Likely that one, maybe a couple more individuals, and then we started getting local community spread. So every single individual matters, and it's a time where it is unprecedented that we all have to take such measures. But if we all can do our part, I'm hopeful we can get this to be a manageable epidemic and get back to a little more of our normal lives.
But once the bail comes down and everything's better, I mean, what's going to happen in the future? That's another question in itself, right?
Yeah, definitely. I think right now, planning for that longer term is hard to know.
Yeah.
SARS was the SARS outbreak was relatively shorter. The viral transmission dynamics and characteristics continue to be different from SARS for COVID. So it's hard to know just yet how MERS is technically, still a pandemic, but it has affected so few individuals. The case fatality rate is horrible. It's in the upwards of 30% for MERS, but because it's been relatively concentrated, it never affected so many millions of people worldwide. So it's really hard to know what COVID-19 will look like, a year from now. Certainly people have forecasted that it's going to take, full 18 months to gain, total control of the epidemic, etc. It's hard to know what will happen in the far future. I think what those of us who are in the healthcare field are really preparing for is that peak and the few weeks to hopefully no more than a few months of that sort of big chunk of the curve where we're seeing the most number of cases. And then it's true that 80 some, from China, at least the data suggests that 80 some percent of the people only have mild disease, 15% have moderate, and it's only 5% that have severe. But that 5% can translate to a large absolute number, particularly when you have a aging population like Italy, we've seen in Italy, and it can just completely overwhelm the healthcare system. And I
heard that the reason why Italy had such a hard time is because there is a huge aging population, correct?
There is, yeah. I've seen some statistics such as it's the second largest country with aging population. But then again, Japan has a fairly large aging population as well. And why Japan has managed to keep its epidemic curve flatter than Italy remains a little unclear to me. And I suspect it's kind of, unfortunately, I think US, we're going to be like Italy. We just didn't take enough measures early enough. You know, surely the whole of Italy is on a lockdown right now, but I think it was probably too late when that happened.
Mm-hmm.
So I'm afraid we're unfortunately headed in the same trajectory. But if as
Mm-hmm.
much as we can do, every little thing helps right now.
Oh, for sure. Absolutely. I mean, um, there was one more question, main one. Oh, when we're talking about kids playing together, because that's a hard thing if you have children, is it better like just to play with just one other family that you know are isolating themselves as well? Would that be okay?
Yeah, I've thought a lot about this because personally, my family has taken a relatively strict approach to the self-isolation because my 70-year-old mother who has diabetes, hypertension, high cholesterol, all the risk factors that we know move people from mild, moderate to severe infection,
Mm-hmm.
came to us just a few days before all of this started. She came at the end of February, was planning to stay for a few weeks and then go back. And now, you know, given with all the things moving so quickly, she's ended up staying here. So to try to minimize exposure to her,
Oh,
we've
wow. Yeah.
really we've really been sort of on a at the moment on a sort of strict approach where we're not letting our children interact with other children.
Right. Right.
Um, but 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 I, you know, it's a practical question. How long is that going to be
Yeah.
sustainable? You know,
Yeah.
my daughter is already crying that, you know, thinking about her friends Apple, Ren, and others. I don't know how long, and is asking when can we do a play date? When can we go over and play?
Mm-hmm.
So, you know, that's what I've mentally thought, that what we would do is prepare ourselves, think about it very carefully, and,
Mm-hmm.
you know, sort of ahead of time determine these are the 3 or 4 families we're going to interact with only. And so that
Mm-hmm.
you kind of maintain a smaller social cluster. So if someone does become ill, and that's one of the issues with this virus is that there's transmission going on, for sure, viral shedding and transmission before you know you have symptoms.
Right.
So, you know, you can't, people don't even know they may have the infection and are out and about and doing things.
Mm-hmm.
Um, and so, you know, that's kind of the thought we've taken is, or that I have thought of so far, is that probably in the near future, when we become really desperate, what we'll try to do is, you know, limit ourselves to 2 or 3 families, maybe 4 that we only interact with and know that those are sort of our social clusters. But it's really tough because, you know, um, I know other families are not taking the same approach as we are, but their risk calculus may be different. You know, maybe
Oh,
they don't have.
we are. I know that for sure.
Yeah,
Luckily, we're all home, so we don't have to go out. Rachel doesn't have to go to work, and I work from home, and you know, we just go around the block or go out, you know, walking somewhere or something. So, but a lot of people don't have that privilege. You know, a lot of
yeah,
people still have to go to work. Hmm.
yeah. People still do. Yeah, and those who are, you know, first responders.
Yeah.
It's a, you know, another layer of thinking about how to protect our own families. Certainly, you know, a lot of appropriate measures are taken in hospitals, but there are definitely, you know, likely transmissions that occur despite all of those measures. There probably are. Um, you know, I say that with a big asterisk for speculation because so far, at least, you know, 1 or 2 studies that are really small. These are case reports. You know, suggest there may not have been onward transmission to healthcare workers. That probably the healthcare workers are getting their COVID-19 from a community source, being somewhere else out in the community, not in the healthcare system. But I just suspect it's inevitable that we will have some level
Hmm.
of transmission in the healthcare environment. And my hope is just that it's small. Yeah, it just adds another layer to this. You know, my partner, who's also a physician, you know, we've come up with the thought of like, okay, we need to have our work clothes and keep them, you know, as far away from the home as possible, change before we get back home. Every time we come in and out, you know, of any interactions with patients, we're being so vigilant about washing our hands, etc.
Hmm.
Um,
So
so
you both are
definitely,
seeing patients. You both are,
yes,
yeah. Wow. Okay.
yeah, yeah, and you know, I'm in infectious diseases, and we're we're trying not to necessarily, for example, at Harborview Medical Center, we're trying not necessarily to see every single patient who has COVID-19. If
Yeah.
the other teams don't need our help, um, but definitely we're involved in care for many of them, and the division is, you know, much more involved in procedures and protocols and sort of
Mhm.
larger operations aspect
Right.
of
Right.
the response.
Well, I just wanted to send out lots of, love and just like really, we're all so grateful that you guys are on the front lines and doing the work and being there for everybody, and because it's got to be really tough right now for everybody in healthcare, especially right on the front lines of everything. I see it a lot on with my friends who are there, like nurses at urgent care, Kaiser Permanente, and people who are working Tacoma in the hospitals there, and we have a lot of different nurses that we know. So I know it's tough, and I
Yeah,
just
and
want to
I
say
and
thank you.
I have to see what one of the um, ER physicians said. I think at Evergreen, which is really the bulk of the things does goes to the nurses. They are really the individuals who interact the most with our patients. They're dealing with, you know, a lot of the sort of needs that our patients have, from feeding, cleaning, toileting, you know, all these aspects. Nursing and related nursing staff are really, really the true heroes coming out of this work. Yeah, we're very grateful, especially at University of Washington and specifically at Harborview, to have such an amazing, committed cadre of staff who've you know, volunteered to do so much for COVID-19. It's
Hmm.
been really such an amazing experience.
And to put a positive spin at the end of this, it's like the communities are all coming together to help each other out, is what I've noticed. People who are needing food or who are needing medications or whatever, and they're afraid to get out, or I mean, just whatever you name it. I think people are really being there for each other, and
It's
that's
You're right, Taz. It's been amazing to watch the threads on Nextdoor, Facebook, you know, every sort of challenge or bottleneck people think of, others are stepping up to answer them, to meet, you know, to resolve them. It's been really amazing and beautiful. I truly believe we're going to come out stronger as communities and societies after this. It's
yeah,
just a little challenging while we're going through it, but as you say, Taz, we're going to come out stronger.
it's making us think on a deeper level, right? That we're all connected. We're all, it's very holistic, and we can't do it without each other. So.
No, that's one of the most amazing things about this, was thinking about how SARS spread initially, and
Hmm.
there too is human to human transmission. It just, you know, that was 2003 to 2004. Comparing to that, you know, just in less than 15 years, 15 so years, our global sort of interaction has just grown exponentially. And you know, we're going to see probably a lot of interesting data come out that show, you know, this person went here and then traveled here and then here and here, you know, like all this physical interconnectedness.
Hmm.
Yeah, it's beautiful in some ways. And you know, yeah, I've been reflecting, you know, we live, I've been thinking about ecology. You
Hmm.
know, we are one species in the many species that make up planet Earth.
Hmm.
And you know, sort of philosophical reflections like, you know, maybe these are the kinds of waves that nature has planned um, to take care of planet Earth. You know, not to imply something morbid, of course our responsibility is you know, to improve people's health as much as possible with the resources we have. But it has brought, you know, into picture these sort of larger questions. We, you know, in a different environment, I want my children to be exposed to as many viruses and pathogens as possible. You know, I'm one of those kind of ID people that say, you
Play in
know,
the
yes,
mud, yeah, get dirty.
yeah, exactly. Play in the mud, get dirty, right?
Yeah,
Um,
yeah.
if you've had your tetanus vaccine, go ahead, go barefoot. You know? But you know, to like embrace this and not be afraid of the world out there and nature out there. But it's been
Mhm.
really humbling to now see COVID-19 and be like, oh yes, we need to wash our hands every time we interact with others or go in and out of the house. It's yeah, definitely humbling to see things um, change in my own thinking in a matter of weeks.
Yeah, because life is very fragile as we see now, right? And I mean, for most people that get it, they'll be fine. But then there's the people who are health compromised and people who are older that this is the reason where we're doing all these things. And we don't want to overwhelm all the hospitals and the staff. And you know, it's already going to
Right.
be quite. It's going to be quite a show, I would imagine. It's going to be something else. But we want to do the best that we can to help everybody out, and to show support and love. So I think that's how I want to end this. Yeah,
Thank you, Taz. Definitely, we're gonna yeah be there for each other and be as positive as possible as we go
exactly.
through this together.
All right. Thanks again for being on the show, Rena. And we're all there behind you, standing strong. And we know that we're all going to get through this just fine. Yeah. Okay.
Thank you.
Thanks. Take care.
Have a good day. Bye, Taz.
Bye bye.